Welcome to the Guidance Functions webinar on clinical quality databases. In this webinar on clinical quality databases, we will cover the following areas: approvals, clinical quality databases, requirements for data access, and the application process. In order to access data for research use, some reviews and approvals are required beforehand. All projects that store or process personal information or data must be listed on the record of processing activities. A record of processing activities is documentation of information about who processes personal identifiable information, which data is used, and for what purpose. An exception are projects where only anonymized data is used. These projects do not have to be reported to the record of processing activities. The record of processing activities is available in the regions and at the universities. Private companies must keep records of processing activities themselves. Notification procedures, templates, and such varies among regions and universities. Where you have to report your project depends, among other things, on where you are employed. In the region of southern Denmark, notification to the record of processing activities is based locally at the hospitals, but in other regions it is collected regionally. Clinical quality databases collect and process information and data about the healthcare treatment of a defined patient group. According to Section 196 of the Danish Health Act, hospitals, institutions, and practicing health professionals are obliged to report to the clinical quality databases. This report can be made without consent from the individual according to the Danish Health Act. The clinical quality databases contains information about the various parts of a patient course, and together they can provide a full picture of the overall treatment quality, making it possible to identify where in the treatment process potential improvements should be made. The quality is measured using indicators, which are selected in order to measure that the quality level reaches the desired level. These indicators most often measure processes or results. For example, how many patients have had a CT scan or survival after a specific type of operation or treatment. The indicators vary among the different disease areas and are selected by the professional steering groups and clinicians within the area. In addition, there is also patient representation in most of the databases. The clinical quality databases consist of approximately 85 nationwide databases that measures the quality of healthcare treatment for a number of patient groups. The databases are part of the region's Clinical Quality Development Program, also called RKKP, which administers the databases and contributes to developing healthcare quality in the Danish healthcare system. For the individual hospital department, the database is a quality development tool that the department uses to monitor and improve the quality of healthcare treatment. The information for the databases is registered and reported by healthcare staff at the public and private hospitals, as well as private practitioners. In addition to providing quality support, RKKP makes data available for relevant legal research projects in the health field. The 85 clinical quality databases are divided into the following departments. The first is cardiovascular, surgery and emergency area, which includes databases such as the Danish Heart Registry, the Danish Intensive Care Database, and the Danish Ligament Reconstruction Register. The next main area is cancer and cancer screening, which includes databases such as the Danish Bladder Cancer Database, Danish Palliative Care Database, and the Quality Database for Breast Cancer. The last main area is psychiatry, gynecology, obstetrics, and chronic diseases, which includes databases such as the ADHD database, Danish National Clinical Quality Database for Births, and Danish Forensic Psychiatric Database. All the databases each have a steering group that is responsible for the content and operation of the databases. These steering groups consist of doctors, nurses, therapists, and other professionals. Application for data access is directed at RKKP, which has its own application procedure and guidance for this. Access to data from the approved databases at RKKP does not require permission for disclosure from the Regional Council. On RKKP's website, you can access variable lists. These lists can be used as a form of checking list to define and locate which data you want to apply for when you submit your application for data extraction to RKKP. As with other data providers, there are some requirements to access data at RKKP. The research must take place in the territorial area of the Data Protection Regulation. Data minimization must be taken into account, which means you only have to apply for the data you need, and data may only be used for research purposes. The application is submitted directly to RKKP, and it is relevant to mention that you do not have to have an authorization as you need at other data providers such as the Danish Health Data Agency and Statistics Denmark. There are 4 steps in the application process at RKKP before a data extract can be created and handed out. First, you must complete a data access application, which is completed in RKKP's own online system. The application is then processed in RKKP, where it will be checked whether the formal conditions have been met before the application can be forwarded. Hereafter, the application is sent to the database's RKKP team, who will examine the relation between the requested variable list and the application and whether the requested data is available, including whether the desired extract can be clearly defined. The team contacts the applicant in case of any questions and forwards the application to the steering group. Finally, the application is processed by the steering group for the relevant clinical database. The steering group assesses whether the requested data is factual, necessary, and relevant for carrying out the study. After approval, a data extract can be created and delivered. If the application has been completed correctly and there are no further questions or comments on the application, the time horizon for receiving the data extract is approximately 2 months, or as soon as possible after the submitted application. You can read more about RKKP and access to their clinical databases for research use at this link. This was the Guidance Functions webinar on clinical quality databases. Thank you for watching.